And I've just realized Dr. Amit has zoomed in. So over to you, Doctor, because as I was searching for you, I saw a Zoom user. So I said, Doctor has zoomed in. And so over to you, Doctor.
Thanks, Bali. Thanks.
Thanks.
Hello, everybody. Good evening once again.
Good evening.
Nice to meet you after a long time. Yesterday was World Health Day. 7th of April is World Health Day, and it's very special because it is observed on the day that the constitution of the WHO had come into force. So, and it happened in 1948. Last year, they completed 75 years of this. So it's the WHO working for so many years to ensure that all of us have the best of health. The primary focus of the World Health Organization is the theme they had last year, is health for all. It's important for them, and it's important for all of us as healthcare providers to ensure that all of you are healthy and you get this health. The problem about it is that many a times people don't have access to health. And even if they have access to a healthcare facility, they may not be able to afford it. If you look at the statistics, it's quite startling. You know, that's the reason why this year, the World Health Organization is trying to drive in the message to each and every one of us that my health is my right. And all of you need to know that. Your health is your right. Health is not a privilege that only some people can get. Health is a right of every individual. Everyone should get this health. And if you understand that health is your right, you will then demand it. If we as healthcare providers understand that health is your right, we will ensure that we do everything possible to ensure that you get the right quality care. It is not enough to just get health care, but it's important for you to get good quality care. And that's what the WHO is reminding us. There are over 140 countries around the world where the constitution says that health is a right. But unfortunately, not many are trying to put this into force and ensuring that everybody in their country has a right or access to healthcare, access to affordable healthcare. And that's the big problem. More than 50% of the people around the world do not have access to good quality care. More than 100 million people are pushed towards below poverty line because of a catastrophic healthcare expense. Many of you may even know this, might have experienced this. If you go to the hospital, sometimes you pay through your nose. So therefore, my tip for today is to try to motivate all of you all to have some kind of a health insurance. The government itself comes up with the DDSSY. In Goa, we have the DDSSY scheme. So make sure that you're enrolled on the DDSSY scheme so you don't end up in a crisis like this, a catastrophic crisis like this. In order to bridge the gap, all of us need to be innovative. And there are certain sections of people who tend to be left out when we're talking about healthcare or health for all. And one of the big sections are the senior citizens. They tend to be left out because, one, they don't think, what can I do now? I'm so well, I low type of a thing. They have kind of a negative attitude. They feel they don't have to do, or they depend on someone else to do things for them, or they feel there'll be a burden on someone else. If I ask someone to take me to the hospital, they'll have to stop going to take leave and this and that, and it'll become very difficult for them. So you need to know that there should be ways by which you need to make sure that you get your best healthcare. And if it's not possible for you to get to the health center, then the health center should come to you at some point of time. There are outreach programs by which this happens. So from today onwards, start thinking about it. Start thinking of health as your right. And if there's anything that you think the health services should do for you, you need to write to us. And we can put all this together, and I can always share this information with maybe our government. They're always reachable. We can share this information. These programs would be useful to you. A very good example by which we are trying to reach out to people and give them health information is the Memory Cafe itself. I mean, by using a Zoom platform like this, by no extra cost, no cost to you all, and very minimal cost to all of us, we can reach out to you with very good quality, kind of a motivational program by which you keep your brain stimulated. It's very important to prevent diseases. So this is a very good example by how we can provide health for all and ensure that your health is your right, and we recognize it and we try to do our best for that. So my tip for you, or my tip for you today, is try to ensure that all of you have some kind of health insurance, private insurance, or it could be the government insurance. That's going to make sure that you have good access to quality care. The government of Goa is giving, but we're trying to focus a lot with our services through the primary health centers, through the health and wellness centers, and through the tertiary healthcare hospitals. It's always been free of cost. And we're trying to ensure that we improve the quality of all these services as well. So stay safe and stay healthy, and wish you happiness and good health throughout the year. Thank you.
Thank you, Dr. Amit. In fact, so informative. Health is our wealth, and I think laughter is the best medicine. So here in Memory Cafe, we are always so happy and jovial, and I think that's one step towards good health and happiness. So thanks so much for sharing your